ElderlyTV warmly welcomes you. Have you ever considered that daily showers, something we've long believed to be healthy, might actually be quietly harming your skin, draining your energy, and even putting seniors at serious risk for accidents? It may sound hard to believe, but Mrs. Helen, age 75, lived through it. A fall in the bathroom left her with a fractured shoulder. From someone who used to shower every morning, she became afraid of water, and her doctor's advice: only shower once or twice a week. So what's really going on? For decades, we've been taught that cleanliness equals health. But the latest science shows that after age 70, the very habit of daily bathing can begin to weaken your skin, sap your energy, and jeopardize your safety. In this video, ElderlyTV invites you to explore 7 surprising truths that few people ever say out loud. Why does bathing more often actually dry out and damage aging skin? Why is the bathroom not the staircase, the most dangerous place in the house after 70? And why do leading geriatric doctors now recommend bath less, live smarter? We're not saying you need to give up bathing, but if you've ever felt tired after a shower, anxious about stepping into a slippery tub, or puzzled by persistent skin irritation, then this video might change the way you care for yourself every day. Because good health doesn't begin with soap bubbles. It begins with understanding your body and having the courage to adjust. If you find this topic helpful, please like and subscribe to support ElderlyTV. And now let's begin with the first truth, the one most people overlook when they grow older. 1. Daily bathing can harm aging skin. Your skin is changing, and not for the better. After age 70, your skin is no longer as thick elastic or resilient as it once was. It becomes thinner, drier, and more fragile. So much so that even clean water and soap can do damage. Studies from the University of Pittsburgh and the University of California, San Francisco reveal the outer layer of skin, the epidermis, gradually loses its thickness. Oil and sweat glands drastically decline, removing the skin's natural barrier. Collagen and elastin levels drop, making skin less elastic and more prone to cracking. At this stage, the habit of bathing every day, especially with hot water and strong soap, is no longer about hygiene. It becomes an attack on your skin. Mrs. Helen, age 75, once had to wear gloves to bed because the itching was unbearable. The skin on her legs peeled, cracked, and even bled. Despite using all kinds of lotions, her doctor advised reducing showers to twice a week and using only lukewarm water. 3 weeks later, she exclaimed, "I stopped scratching, started sleeping better, and felt like myself again." Dr. Henry Thompson, a geriatric specialist, explains, "Every hot shower strips away the little protective oil your skin still has. At this age, your skin no longer has the ability to bounce back. Once that oil barrier is gone, your skin becomes dry, tight, itchy, and is at risk of developing a condition called xerosis. Skin cracks and flakes, may bleed or sting with movement. Most importantly, increased risk of infection. Even a tiny skin fissure can let in bacteria causing dermatitis, abscesses, or in severe cases, sepsis if left untreated. If your skin feels tight and itchy after each shower, that's not normal. It's a cry for help from your skin. And sometimes what your body needs most isn't another shower, but a chance to rest. 2. Bathing less often may help prevent skin infections. Being clean doesn't always mean being safe. Many older adults bathe daily in hopes of staying hygienic and germ-free. But in reality, bathing too often can actually make your skin more vulnerable to bacterial infections. Why does this happen? Hot water and soap strip away the skin's natural oils. The outer layer epidermis loses moisture, causing dryness and cracking. Tiny skin fissures, sometimes invisible to the naked eye, become entry points for bacteria. Common bacteria, like Staphylococcus aureus, which naturally live on the skin's surface, can enter through these microcracks and cause infections such as boils, abscesses, or even cellulitis, a potentially serious skin inflammation. Mrs. Helen, whom we mentioned earlier, experienced 3 skin infections within 6 months. It began with itching, then redness, irritation, and oozing. Her doctor concluded this wasn't caused by outside germs. It was her own skin losing its defense because of overwashing. Since reducing her baths to twice a week and using a damp cloth daily to clean essential areas, like the underarms, groin, and face. She hasn't had a single recurrence in over 2 years. A study from the University of Michigan, conducted in a senior care facility, found residents who bathed daily had a 35% higher risk of skin infections. Those who bathed 2 to 3 times per week, while cleaning key areas with a washcloth daily, not only had fewer infections but also needed fewer antibiotics. Smelling fresh doesn't always mean staying healthy. For older adults, the top priority should be preserving the skin's natural barrier, not thinning it, not cracking it, and certainly not opening the door for bacteria to enter. If you're caring for an elderly loved one, or if you've personally experienced persistent redness or irritation without clear cause, remember this. Bathing less might just be the best thing you can do for your skin's health. 3. A fall is more dangerous than dirt. Do you know the most dangerous place in the house after age 70? It's not the stairs, it's not the kitchen, it's the bathroom. According to the Centers for Disease Control and Prevention, CDC, 1 in 4 adults over age 65 experiences a fall each year, and 80% of those falls happen in the bathroom. Slippery floors, cold tiles, steam that blurs your vision, a bathtub wall that's just high enough to trip you. To a younger body, these are minor inconveniences. But to older adults, with brittle bones, slower reflexes, and stiff joints, even one misstep can be devastating. Mr. Frank, age 73, once lived independently. He loved gardening and taking morning walks, but everything changed the day he slipped stepping out of the tub, fractured his hip, and was bedridden for 3 months. I lost both my confidence and my freedom, he said. His physical therapist put it bluntly. Every trip to the bathroom is a risk. Fewer showers equals fewer chances to fall. Now, instead of bathing 7 days a week, Mr. Frank showers twice a week and uses a clean washcloth every morning to wipe down key areas. The result? Less fatigue, no more anxiety walking into the bathroom, and most importantly, a return of self-confidence. Let's be honest, a little body odor is nowhere near as scary as a broken hip. You can wipe under your arms, put on fresh clothes, and spray a light deodorant. But there's no quick fix for a fall. If you live alone or have a loved one who's starting to show signs of unsteadiness, remember this. Bathing less isn't laziness. It's a smart, proactive way to stay safe and to hold on to your independence. 4. Your body can clean itself better than you think. It may sound strange, but it's true. Your body already has its own natural cleaning system, one that's been working your whole life without soap or hot water. Here's how your body stays clean every day. Your skin produces oil sebum, which forms a natural moisture barrier that helps block dirt and bacteria. The skin microbiome, made up of billions of good bacteria that protect your skin from harmful ones. Natural shedding desquamation. Your skin releases up to 1 million dead cells per hour, taking dirt and excess oil with them. It's a complete self-regulating ecosystem, but it only works if you let it. Overwashing, especially with hot water and harsh soap, disrupts that system. Hot water dissolves your protective oils. High pH soap kills off good bacteria. Over-scrubbing strips away delicate new skin cells, leaving your skin weaker and less protected. The result? Drier, more inflamed, and more sensitive skin. Mrs. Ruth, 75, from Arizona, used to think, if I don't bathe every day, how can I be clean? But when her dermatologist suggested she shower just twice a week and use a gentle washcloth on the other days, something surprising happened. My skin stopped itching, felt less dry, and oddly enough, I felt cleaner than before. Turns out your body is quietly doing its job every day, as long as you don't interfere. Wiping underarms, groin, and face daily is enough for good hygiene. A full-body shower every day isn't the only way to feel fresh. Bathing less often allows your skin to reclaim its natural defenses. If you've ever noticed your skin feeling smoother after a vacation with fewer showers, or less irritated in winter when you avoid water, that's not a coincidence. That's your body saying, thank you for finally letting me do what I'm built to do. 5. Experts recommend bathing just 1-2 times a week. You may have heard this advice before and instantly dismissed it. How could I possibly go a whole week with just 2 showers? But the truth is, this isn't some casual suggestion. It comes directly from top experts in geriatrics and dermatology. According to the American Academy of Dermatology, and physicians at Johns Hopkins University. After age 70, most older adults should bathe only once or twice a week, unless they sweat heavily or have specific medical needs. Why such a limited schedule? Aging skin is already thinner and drier with slower regeneration. Frequent bathing disrupts the skin microbiome, causing dryness and inflammation. Older bodies have a harder time regulating temperature, blood pressure, and breathing during showers, leading to fatigue or even dizziness. But does bathing less mean being unclean? Not at all. You can still wipe down your body daily. Wear clean clothes, brush your teeth, and keep your hair neat. Use a warm cloth to gently cleanse underarms, groin, and limbs. Bathing less often isn't neglect. It's about honoring the body that is gracefully aging. Mrs. Linda, age 79, once felt embarrassed to cut back on her showers. Her doctor's advice made her hesitant, but after just a few weeks, she noticed something remarkable. Her skin felt softer, no longer flaky. She didn't feel drained or dizzy after showering. And most surprisingly, no one noticed any body odor. I feel more comfortable now, she shared. Not because I bathe less, but because I understand myself better. Everybody tells a different story. If you're still active, sweating often, you might need to shower more frequently. But if your activity is limited, your skin fragile, and your energy lower, consider slowing down. Staying clean in gentler ways. Remember, good hygiene isn't about how many showers you take. It's about how wisely and lovingly you care for your body at this stage of life. Daily showers can drain seniors of energy. Showering, it sounds simple enough, but after age 70, it's no longer as easy as it once was. Many older adults report feeling not refreshed, but exhausted after bathing. Some feel dizzy. Others need to lie down for hours. Instead of a boost, the shower becomes a burden. Why does this happen? According to research from the Journal of the American Medical Association, JAMA, warm water causes blood vessels to dilate, which can lower blood pressure and lead to lightheadedness, especially in those with heart conditions. People with lung diseases like COPD may struggle to breathe in hot steam. Movements like bending, reaching, or standing for long periods trigger joint pain in those with arthritis. Getting in and out of the tub requires balance. Those with weak nerves or poor stability are more prone to falls. Mr. Thomas, age 82, once believed daily showers kept him on schedule. But he realized something troubling. After every shower, I had to lie down for at least an hour. My whole morning revolved around just getting clean. His doctor suggested showering every other day and using a shower chair with a handheld nozzle. Soon, things changed. He had energy to read the morning paper. He could eat breakfast without rushing. He even had strength left for an afternoon walk. Staying clean is important, but having the strength to live your day matters even more. You can shower 2-3 times a week. Use a damp cloth to wipe down on other days. Sit on a shower chair and use a handheld shower head. Choose to bathe when you feel strongest, not when you're tired or full. No single shower should take away your entire day. After 70, your body is like fine porcelain. Every movement needs care. Every drop of energy must be saved for what truly matters. If bathing is stealing your joy, it's time to adjust. Because no one gets a medal for being the cleanest, but having the clarity, energy, and peace to enjoy each day, that's the real reward. 7. Hygiene isn't just about bathing. It's about smart self-care. We were raised to believe that a daily shower means you're clean. But after age 70, that idea no longer fits. Hygiene is not just about water soap and a shower head. It's a system of daily habits, where small intentional acts can leave you feeling clean, refreshed, and safe, without needing a full bath every day. Here are the secret weapons of seniors who care for themselves wisely. Gentle wipes to freshen underarms, groin, face, and limbs every morning. Clean, breathable clothing changed daily to prevent odor and moisture buildup. A touch of deodorant or herbal powder for all-day confidence. Brushing hair, trimming nails, shaving small acts that make a big difference. Oral hygiene, brushing and rinsing morning and night is essential to overall cleanliness. Dry shampoo or warm towel wipes for the scalp, especially helpful during cold days. Mrs. Dorothy, age 84, no longer stands under the shower every day. Instead, she has a little care corner beside her bed, a warm cloth, clean water, soft towels, and her favorite essential oil. Each morning I freshen up, comb my hair, dab a little oil, and I feel clean, alive, and good. No fear of slipping, no shivering after a shower. You see, true hygiene isn't about how often you bathe. It's about how well you adapt to your body's changing needs. You don't have to cling to an old standard of clean. As your body changes, your standards can evolve too. Hygiene is a form of self-respect, but self-respect also means knowing how to care for a body that's growing more fragile. It means choosing wisdom and gentleness over rigid routines. You don't need to bathe daily to be worthy of respect. You only need to know what your body truly needs, and live in a way that honors that truth. We've just walked through 7 surprising, yet scientifically grounded truths about bathing habits after age 70. And perhaps after all that, the biggest surprise isn't bathing too much can be harmful, but rather, bathing less can be a sign of wisdom. Bathing less so your skin can rest, so infections can be avoided. Bathing less so you can conserve precious energy each day. Bathing less so you reduce your risk of falling and stay independent longer. And bathing less so you can begin a new kind of self-care. Gentler, smarter, kinder to your aging body. No one will judge you by how many times you bathe in a week, but life will reflect how well you love and care for this body, day by day. If something in today's video spoke to you, please leave a comment. Your small story might be the comfort someone else is quietly searching for. And if you feel Elderly TV brings value to the senior community, please subscribe to the channel, turn on the bell, and keep walking with us on this journey. Growing older isn't about decline. It's about slowing down so we can live more deeply. Thank you for watching Elderly TV. We'll see you again soon in another gentle, meaningful video.